Let me say that the Ghana Health Service and the Ghana Armed Forces have had a very long-standing collaboration and partnership in improving the quality of health services, including ensuring that there are appropriate systems for infection prevention and control over the years. This year is an important landmark in the history of the 50 years of implementing infection prevention and control, especially because last year the World Health Assembly acknowledged the importance of IPC and has asked the Director General of the World Health Organization to take so many steps to ensure that all countries around the world have systems in place to ensure infection prevention and control. And so last year also, for the first time, we had the first global IPC report in which Ghana featured very well as a reflection of the contribution for all of us. And for the very first time, the World Health Organization is also developing a global strategy for infection prevention and control, which will be due by July 2023. This is very important, especially in the midst of the pandemic response across the world. The Ghana Health Service and the Ghana Armed Forces have collaborated in improving IPC, especially in capacity building for our health workforce, in mobilizing resources, and even more recently during the COVID response, in distributing protective equipment and in vaccination activities. Going forward, to improve IPC in our healthcare facilities, the Ghana Health Service is ready to partner with the Ghana Armed Forces to make sure that the policy environment within the 37 military hospital and 8 MRSs across the country are convenient for the implementation of IPC in healthcare facilities. We are also willing to support the Ghana Armed Forces to build capacity further for all healthcare workers. As mentioned, that IPC is everybody's business, and not only the business of clinicians, but the business of every healthcare worker. We must also ensure that there are guidelines and protocols in our healthcare facilities to support healthcare workers in upholding IPC practices. And we must also offer support and protection for our healthcare workers. We all saw how healthcare workers died during the COVID response because PPEs were not available for them to use. And so these are key interventions we have to put in place, bearing in mind that the patients, their families, and communities remain key stakeholders to ensure IPC in our healthcare facilities and in our communities as well. Now that we have so many outbreaks, one following the other, we cannot really break the chain of infection if our communities, our patients do not comply with IPC practices. And so I want to say that we have an opportunity once again to renew our commitments to infection prevention and control in our healthcare facilities to make sure that ultimately we reduce hospital-acquired infections, we protect patients, and also protect ourselves, the healthcare workers. And so as we say that the future is for infection prevention and control, really the future begins from now, and all of us are part of this future.